Hello students, welcome to VHSE classes, and today we are starting with a new chapter, that is hospital admissions and discharge. So in this chapter we are going to talk about admissions, we are going to talk about the purposes of those admissions and what are the steps of health assessments, what are the procedures in these admissions, okay, and what is your role as a nurses in admission and discharge, and how you will explain and what are the types of discharges and what is the procedure for discharge. So in this chapter we are going to talk about admissions. Okay, so what is hospital admission? So as we all know that whenever a person is going to hospital for the purpose of a treatment or for the purpose of diagnosis, that is called as hospital admission. But when he is staying there for this, okay, he is staying there for overnight, that is hospital admission. So admission means when a patient admission of a patient means when we are allowing and facilitating a patient to stay in the hospital unit or ward for observation, investigation, treatment for the disease or for the disease he or she is suffering from. So, what are the various definitions of hospital admission? Hospitalization is admissions to the hospital as a patient. Okay, when a person is ill, he is coming to the hospital and he is staying in the hospital for the treatment. That is hospitalization. Another definition is it is the entry of a patient in the hospital for the diagnostic and therapeutic purposes. So, it's not always about the therapies. Sometimes patients admit in the hospital for the diagnostic purposes too, for some lab tests, for some biopsies. Okay, so for that patient can be admitted in the hospital. Admission is a process where patients need admission in the hospital for observation, investigation, treatment, and care. So these are the four basic tasks that we will do when the patient is admitted in the hospital. So what is the purpose of hospital admission here? So first one is observation. We have to observe the patients, we have to observe their condition, and we have to make the observation how their condition is changing while they are staying in the hospital and we are providing care to them. Okay. Another one is immediate care. We have to provide the immediate or emergency care to the patients. We have to investigate. Okay, investigation might be the lab test or might be the biopsies. And after the investigation, we have to provide the treatment to the patients, and we have to meet the needs of the patient, and we have to be ready for the emergency conditions. So the first one is observation. We will observe the patient. Okay, for whatever the time the patient is staying in the hospital, we have to observe them. We have to observe their signs and symptoms. We have to observe their general condition, and we have to check the patient. For example, we have to check them for the chest pain, palpitations, and other symptoms. Next is immediate care. Sometimes the hospitals are being admitted in the hospital on the emergency basis, and we have to provide them care first. Okay, immediate treatment we have to provide them. After that, we can investigate them, the particular disease condition further. Next is investigate. Okay, so first of all, if the patient is coming to us with a problem, we have to provide the immediate care, and after that, we have to do some medical tests so that we can find out the exact reason behind that disease condition. Next is treatment, and this is a step-by-step process. Okay, so once we will find out the cause of the treatment and cause of the disease and what kind of disease that is, we will provide the treatment to the patient. And next is meet the needs of the patient. So here we will meet the physical needs of the patient. For example, such as terminally ill patients are there, patients who are suffering with chronic diseases. So we have to assist them because they are not able to meet their physical needs. They cannot perform their daily activities here. Okay, and ready for the emergency. So here we are talking about the hospital setting and admissions. So we have to always ready for the emergency situations. Okay, and we have to be prepared and we have to monitor the patient if there is a need of emergency treatment. So this is all the purpose of admission, that we have to provide, we have to observe the patient, we have to provide treatment to the patient, we have to do the diagnosis, okay, and we have to meet the needs of the patient, and we have to ready for the emergency situations. Next is types of hospital admissions. So students, types of hospital admissions are broadly classified into three broad categories. The first one is based on the purpose of admission. Okay, so what's your purpose of admission? So it is classified into two: therapeutic and diagnosis. Next is on the basis of the stay, okay, length of stay, short term and long term. And the last classification is on the basis of their condition. So one admission is routine admission and another admission is emergency admissions. So the first one is diagnostic admissions. Okay, as the name is suggesting, the patient is admitted to the hospital because they have to undergo some diagnostic procedures. Okay, so as we all know that there are so many diagnostic procedures. Sometimes it is a simple blood sample. Okay, but sometimes we have to identify or to do the diagnosis with the help of surgeries too. For that, patient may need to stay in the hospital. Second one is therapeutic admissions, and these are the most common type of admissions in the hospital setting. Okay, where the patient came with the symptoms and he came in the hospital or he is staying in the hospital for the treatment of that disease condition. That is therapeutic admissions, the regular admissions that are being done in the hospital settings. Okay, so the next classification was the length of the stay. Okay, so how much time the patient is staying in the hospital. The first type of admission is short term admission. Here, the patient is staying in the hospital only for a shorter duration, for example, 24 hours to the 48 hours. Okay, and next one is a long term admission. Here, the patient is staying in the hospital for more than 48 hours. Okay, he needs time for recovery, he needs time for treatment. So, that is long term admissions. Okay, so short term and long term admissions on the basis of the stay in the hospital. And the third one is based on the condition of the patient. Okay, so the first one is routine admission. Okay, so patient was well, it is like patient is coming to the OPD. Okay, and after that we are finding that there is need for hospitalization, so we are admitting the patient into the hospital. So that is routine admission. Okay, patient was coming with a mild to moderate symptoms. But another type of admission here is emergency admissions. Okay, so emergency admissions are when the patient is dealing with some life threatening disease conditions and the patient requires immediate treatment. Okay, and the example of this is cardiac arrest, respiratory arrest, etc., etc. Okay, accidents, shock, traumas. So these might be the emergency admissions which were done on the basis of emergency and the patient required immediate treatment. So these were the classification of hospital admissions. Okay, so after that there comes the categories of admission. Okay, so in which category we will put the patient into? The first one is entitled patient. So when we will say the patient is entitled patient. Okay, so patient is entitled patient when the compensation in the treatment is there. Okay, and because there is a special status like patient is having health insurance. Okay, so those patient will be called as entitled patients. Okay, and the patient who are considered entitled include employees, his or her spouse, unmarried daughter, son up to 25 years of age, parents having valid medical service card. Okay, so entitled patient are someone whose medical bill will be handled by some other thing. Okay, for example, health insurance. Next is paying patients. Patients admitted to hospital by paying cash at the time of admission. Those are paying patients. And the next one is third party payers. Here the patient is admitted to the hospital, but the medical bills or the bills of the lab test, diagnostic procedures, that will be handled by some third party, for example, central government health schemes. Okay, so the bills will be cleared by that agency. Okay, so these are the three main categories of the patients in at the time of admissions. So after that, after the admission, there comes the unit preparation. Okay, so whenever the patient comes into hospital, we have to give them assign them a unit or assign them a bed. So how we will prepare a unit or ward for the patient? So a unit or ward is defined as a division of the hospital or a room or a hall in the hospital which has number of beds shared by number of patients who require similar care. Okay, so unit might be a general ward, unit might be a cardiac unit. So where there is number of patients who are receiving same treatment or treatment for similar kind of disease conditions. Okay, so how to prepare the unit for the patient? So first of all, prepare the admission bed. Okay, here we have to be ready for the patient, and we have to make sure that we have the fresh and clean linen on the bed, and bed is properly made. After that, we have to ensure the equipments. Students, the admission can be on the basis of many things, like it can be a emergency admission, it can be a routine admission, and we have to know that what kind of patient is coming into the hospital, and we have to make sure that all the equipments required for that particular patient are there. Okay, for example, cardiac monitors, oxygen flow meters, oxygen cylinders, suction machines, or the drugs, emergency drugs, which will be needed in that particular condition. After that comes your ensure patient privacy. Okay, so here we have to ensure the patient's privacy. We do not have to overexpose the patient. Okay, so we have to treat the patient with respect, and we have to make sure that we are respecting the privacy of the patient. Next is patient safety. We have to perform the initial assessment of the patient so that we can find out that the patient is not on the risk of fall. Okay, so we have to do those assessments like fall risk assessment, pressure sore assessment. We have to do the pain assessment of the patient so that we can find out the risk for different kinds of conditions. Next is financial burden. Okay, as we all know that hospital admission can be financially burden for the patient or for the family members. So we have to identify the category of the patient. Okay, the first thing is we have to identify the category of the patient, and we have to assess what kind of financial constraint this particular admission can put on the patient, and we have to tell the estimated cost of the treatment to the patient and to the family. And next one is patient isolation. So it's not always necessary the patient isolation, but if the patient is coming with some disease condition which can be spread by droplet infection or by the direct contact, or it is a communicable disease, so in that particular case we have to make sure that we are isolating the patient in that particular area or in that specific isolation wards. Okay, the perfect example of this is COVID-19, tuberculosis. So these patient needs to be put in the isolation wards or the wards designed for these particular disease conditions. So how you will deal with hospitalization anxiety? As we all know, hospitalization, it can be anxious process. Okay, so how here we will deal with this anxiety as a nurse is how you will ask your patient to reduce the anxiety. First of all, be empathetic with the client. Okay, here the patient is not well, he is suffering with the disease condition, there are financial constraints also, and patient has to stay in the hospital. That means the environment of the patient is changing here. Next is orient the patient to the unit or to the wards. Okay, so you have to take some time to orient the patient to the unit so that patient may feel comfortable in that environment. Maintain good interpersonal relationship with patient, which is very necessary so that patient can share their anxieties with you. And explain each and everything to the patient. Okay, tell them what is their bed number, what is the treatment we are planning for them. Okay, what could be the estimated expense for that. So you have to tell everything to the patient. Provide privacy to the patient, okay, which is very necessary. Respect the dignity of the patient. We have to respect the patient, we have to respect the dignity of our patient. And allow the patient to ventilate his or her feelings and clear the doubts of the patient. Okay, so we should have a proper interpersonal relationship with our patient so that they can ventilate their feelings, they can ventilate their fears, and we can also clear their doubts. Okay, so this is how we can reduce the anxiety of the patients. Okay, so next is what could be the procedure of admission of a patient. Okay, what are the steps of the admission in the hospital? So the first step is very easy, that we have to meet and receive the patient. This is the first step. Next is perform examinations, initial assessments of the patient. And after that comes your coordinate with healthcare team members. Obviously we have to coordinate with healthcare team members. Okay, we have to coordinate with the lab technicians, we have to coordinate with the dietitians, physiotherapists, whatever we need for the patient. Next is orientation to the patient and others. So the first one is meet and receive the patient. So what we have to do at this stage? First of all, we have to verify the patient data, which is very important. We have to check the records and we have to check the charts of the patient. After that, we have to introduce ourselves to the patient, okay, and we have to tell them what are the members of healthcare team those will be coming in contact with the patient, okay. So it will reduce the stranger anxiety too, and assist the patient to the treatment area. Okay, so the patient is new in the area, so we have to assist the patient in that area. Ask the patient to change clothes into hospital gown if necessary. Okay, so if they have to stay in hospital for a longer time period and there is a need of a procedure, okay, so for that we need to ask the patient to change into a particular gown and put the identity bracelet on the patient. Next step was the perform examination and initial assessment, and which is a very important nursing task here. Okay, so we have to conduct a general head to toe examination of the patient. We have to check the height, weight of the patient, we have to check the history of allergies, and we have to send the investigations as prescribed by the physician. Okay, whatever the lab work the patient requires, we have to do that. Do the initial assessment, which include pain assessment and risk of pressure ulcers and the fall risk assessment. We have to do that. Next is coordinate with the healthcare team members. As I told you that there will be so many people involved in the patient care and we have to coordinate with them. Okay, so for example, a patient is diabetic, so we have to coordinate with the patient who will be a dietitian there. Okay, if the patient is with fracture, we have to talk with the people in the physiotherapy department. So this is the coordination we need in the patient care. Okay. So next is the equipments. What are the equipments that we need here? So we have to orient the patients to the equipment. We have to tell them how to use call system and telephone system. Okay, sometimes some hospitals may have a call system. Okay, so what is a call system? That the patient will use that call or that bell or that telephone to ask the nurses to assist them, okay, whenever they need something. So next is treatment schedule. We have to orient the patient with the treatment schedule too. Okay, we have to tell them that tomorrow we have planned this, day after that we have planned this, so patient will be ready for that. And visitors timing, which is very important. We have to tell the patient and the family member about the visitors time. And other healthcare team members, we have to orient the patient and the family members to the other healthcare team members for the smooth flow of treatment. And the policies, rules and regulations. Students, every hospital is having a policy, rules and regulations. We have to orient the patient with those policies, with those rules and regulations, okay, so that we can avoid any kind of misinformation or misunderstanding. Next is care of patient valuables. So most of the time, at the time of emergencies, there are the patient with many valuable things. They have the ornaments, they have the jewelries. So we have to make sure that we hand over all the jewelries, all the ornaments, all the valuables to the family members of the patient with proper documentation at the time of admission. Okay, so here we need a proper documentation. So this was the orientation here. Okay, so what are the articles we require at the time of admission? Okay, after we have done the procedure, after we have done the orientation, what are the articles we require? So there are following articles that we require. Okay, for example, assessment form, okay, identity bracelets, uh, allergy identity bracelets, hospital dress, basic equipment for assessment like thermometer, BP apparatus, stethoscope, pulse oximeter, weight scales, toiletries, hygienic underpads or Macintosh, blood vacunators, okay, blood culture bottles, articles for the physical examination and oxygen source. These are some of the articles which we require at the time of admission. And what are the documents we require? The document is assessment form, consent form, okay, and blood requisition form, it might be needed in some conditions, radiology requisition form if we need any radiological examination, admission forms. And what should be in the patient file? There should be doctor progress sheet, there should be nursing care plan, there should be a sheet for nursing notes, there should be vital monitoring chart in the patient file. Okay, in intake and output chart should also be there in the patient file. Assessment scales like pain rating scale, pressure ulcer scale, fall risk scale, that should be there. And after that, glucose monitoring chart, billing sheet, diet chart, and physiotherapy progress chart should be there as per the needs of the patient. Okay, so these are the articles and documents required at the time of admission. So other than that, what are the articles or the documents required in the ICU? Okay, so when the patient is admitting in the ICU, there should be cardiac monitor, ventilators, oxygen source, suction apparatus, intubation trolleys, crash cart, infusion pump, syringe pump, emergency drugs, intravenous fluids, peripheral catheters, dressing sets, suture sets, gloves and gown, and intravenous sets for the blood transfusion, because the patient is being admitted in ICU. Okay? And the next thing is documents. ICU flow sheets and the consent form should be there in the file. So students, what is the procedure for receiving a new patient at the time of admission? The first, there is following types of places where we can get the patients. First one is OPD. Okay, patient came to OPD for a regular checkup, but now the patient needs to be admitted in the hospital for the treatment. Second one is emergency. As we all know, emergency is also a major source of admissions. Okay, next one is private clinic. Some private clinic that refer the patient to the hospital. And referral, for example, from a CHC, from a PHC to the tertiary level hospital, patient is being referred. Okay, so these are the various sources or departments from where patient can be admitted. So what is the procedure of this? The duty manager will inform the head nurse regarding the admission. Okay, we have to tell the head nurse that the patient is coming. Next, we have to prepare all the equipment, and we will make sure that all the equipments we are preparing, those are working properly. And we have to introduce ourselves to the patient, and we have to welcome the patient, adjust the height of the bed as per the patient, and help the patient to take the bed and arrange the help if the patient arrives on stretcher for the shifting of the patient. Okay, so identify the patient using at least 2 identifiers. So students never ask just the name or the bed number. There should be at least 2 identifiers. Okay, that you have to check before identifying the patient. For example, one should be the unique ID. Okay, names can be same, father's name can be same, but unique ID is different for every patient. So we have to check these. Next, we have to orient the patient and complete the process of admission, and we have to change the clothing of the patient, and we have to change the status of the bed from vacant to occupied. So what we can do in the orientation of the patient? First of all, we can provide facilities to the patient. We can provide orientation with the equipments, like there is TV, there is phone in the hospital. We can provide education to the patient. Okay, what are the policies? What are the rules in the hospital? Patient rights. As a nurses, we can orient the patient with the patient right. Okay, there are following patient rights, like patient has the right to refuse the treatment, right dose, right time, right treatment. We have to tell them. Expected length of stay. We have to tell them that patient is how much time the patient is supposed to stay in the hospital, and about hospital routine. So what is the procedure of receiving a new patient? Same as that, we have to provide hospital clothes to the patient so that patient can change into hospital gown or hospital clothes. Check the medications that patient have brought from the home to the hospital. Keep the record of the medications and label it is as it's patient's own medication. Okay, check the orders of the doctor for the treatment and send the initial investigations to the lab, and inform the doctor on duty and dietitian regarding the patient admission, and tell them about the scheduled procedures and treatment when we have to do that, and document every condition of the patient or nursing action that you take on the patient. So this is the basic procedure. So students, in the admission of patient in intensive care unit or emergency department, what are the other things we can do? That is, we have to make sure that the patient is wearing the hospital clothes. We have to make sure the patient is having all the valuables of the patients are handed over to the caregivers. Okay, patient is provided the left lateral position. We are connecting the cardiac monitor to the patient, and we are performing a thorough physical examination of the patient, and we are documenting that so that we can find out is the patient condition is good, it is deteriorating, or it's improving here. Okay, and if the patient is unconscious, we have to keep the Macintosh under the patient's face to collect all the secretions. So this is all about admission of the patient in different departments of the hospital, in the wards, in the units, or in the emergency condition, or in the ICUs. So this was all about the admissions. Thank you so much, students.